To introduce myself, my name is Lisette Hernandez and I'm going to be talking about cervical cancer. What is cervical cancer? Cervical cancer is cancer that starts in the cervix, the lower, narrow part of the uterus. It happens when the body's cervical cells divide very fast and grow out of control. These extra cells form a tumor. Here's two images of the different stages of cervical cancer. Risk factors. HPV is the most important risk factor for cervical cancer. HPV is a virus that is passed from person to person through genital contact, such as vaginal, anal, or oral sex. Smoking. Women who smoke are about twice as likely as non-smokers to get cervical cancer. HIV, the virus that causes AIDS, damages a woman's immune system and puts them in higher risk for HPV infections. This might explain why women with AIDS have a higher risk for cervical cancer. Symptoms. Women with early cervical cancers and precancers usually have no symptoms. Symptoms often do not begin until the cancer becomes invasive and grows into nearby tissue. Symptoms include abnormal vaginal bleeding, such as bleeding after vaginal sex, bleeding after menopause, bleeding and spotting between periods, and having menstrual periods that are longer or heavier than usual. An unusual discharge from the vagina. The discharge may contain some blood and may occur between your periods or after menopause. Pain during sex and pelvic pain. Treatment. Treatment options depend on the following: the stage of the cancer, the type of cervical cancer, the patient's desire to have children, the patient's age. Options include surgery, radiation therapy, chemotherapy, or chemoradiation. The type of surgery needed depends on the location and extent of cervical cancer and whether you want to have children. Radiation therapy uses high-dose X-rays or implants in the vaginal cavity to kill cancer cells. It is used for certain stages of cervical cancer. Chemoradiation is a combination of chemotherapy and radiation. This is often used to treat both early stage and late stage cervical cancer. Chemotherapy uses medicines to kill cancer cells and it may be used to treat advanced cervical cancer. Prevention. You can prevent this by getting a Pap test, a procedure that collects cells from the surface of the cervix and vagina. A piece of cotton, a brush, or a small wooden stick is used to gently scrape cells from the vagina and cervix. The cells are viewed under a microscope to find out if they are abnormal. Another way is to get an HPV vaccine. HPV vaccines are licensed, safe, and effective. Experts recommend that all girls get an HPV vaccine before any sexual activity. Also, you can prevent this by the use of condoms. Research shows that condoms can lower your risk of getting cervical cancer when used correctly and every time you have vaginal, anal, or oral sex. Incidence and prevalence. The graph below shows how many women out of 100,000 got cervical cancer each year during the years from 1999 to 2013. The graph also shows that in 2013, Hispanic women had the highest rate of getting cervical cancer, followed by African American, Caucasian, American Indian or Alaska Native, and Asian Pacific Islander women. Death rates varied by race and ethnicity. The graph below shows that in 2013, African American women were more likely to die of cervical cancer than any other group, followed by Hispanic, Caucasian, Asian, Pacific Islander, and American Indian or Alaska Native women. I hope this information was helpful. Thank you for tuning in.